Hello, I'm Sarah Denford. I'm a research fellow from the University of Exeter, and this short talk is about process evaluation. The first part is about what process evaluation is, and the second part is about how process evaluation can be done. The UK Medical Research Council developed guidelines on how to evaluate complex interventions. In that document, they highlight the need to connect outcomes with processes. However, the guideline didn't provide any information on how to do this. So in 2011, a team of experts started to develop guidance on how to conduct a process evaluation. In that document, they define a process evaluation as a study which aims to understand the functioning of an intervention by examining implementation, mechanisms of impact, and contextual factors. Process evaluation is complementary to, but it's not a substitute for high-quality outcomes evaluation. A process evaluation is a primary study in that primary data is collected. It is an evaluation of a specific intervention. It often takes place as part of a larger experimental study, often using mixed methods to explore multiple components. High-quality evaluation is crucial. We need to know whether an intervention works or not, and we use methods such as natural experiments or randomised control trials to assess this. However, an outcome evaluation conducted in isolation would tell us whether or not the intervention was effective, but it wouldn't tell us exactly how the intervention worked. So if the evaluation showed that the intervention is effective, we wouldn't know whether or not the intervention would still be effective in other contexts. We wouldn't know whether the intervention was equally effective for all its recipients. It may be that the intervention is actually more effective for one group of participants than another. And this is particularly important because we need to know if any intervention is actually increasing the health inequalities gap. Without measuring processes, we wouldn't know whether all components of the intervention are needed. It may be that some of the intervention could be streamlined and made cheaper, or made more effective by reducing ineffective or redundant components. And we wouldn't know whether the intervention was having any unexpected or unanticipated negative consequences. If the intervention is not effective, we wouldn't know why. It may be that the lack of impact is a result of the intervention not being implemented as it should be, or not being received by its target audience, or it might not just be targeting the correct causal mechanisms. So a process evaluation can tell us not just whether an intervention works, but how an intervention works. This means that we can be confident that when we replicate it in other settings or with other populations, we will be able to predict how they will respond. Process evaluations also tell us about implementation issues. For example, whether practitioners were able to adopt the new practices and whether the changes are practical and sustainable. And they tell us about fidelity. And this is crucial as an understanding of exactly what intervention was delivered can explain why it was or wasn't effective. And finally, process evaluation helps us build and refine theory. In order to do this, we need to understand the mechanisms of how change occurs in the target population, and then better theory then informs the basis of improved interventions in the future. So to summarise, a process evaluation tells you how an intervention operates to produce outcomes, and it helps you understand what is going on in complex interventions. This image is taken from the Medical Research Council Process Evaluation Guidance document. The process evaluation will aim to provide a detailed understanding of the elements in blue. So we need to consider implementation, that is, the structures, processes and resources through which delivery is achieved, as well as the quality and quantity of what is delivered. We also need to consider mechanisms of impact, that is, how the intervention activities and the participants' interactions with these activities trigger change. And then the context, that is, the external factors that influence the delivery and function of the intervention. So early process evaluation focused almost entirely on what was delivered in practice, so the fidelity, the dose and the reach of the intervention. And implementation is often used interchangeably with such terms, but actually multiple definitions exist. The MRC framework recommends that implementation needs to be clearly documented, and process evaluation should include an assessment of how delivery was achieved, what was delivered, how this compares with what is planned, and what adaptations were made, so the fidelity. There is some debate about whether achieving perfect fidelity is desirable. Striving to achieve fidelity assumes that we want the intervention to be the same whenever and wherever it is delivered. If an intervention is modified each time it's adopted, then it may become a new intervention in each situation. This makes evaluation across context problematic. However, effective behaviour change interventions are often tailored to recipients' individual needs or characteristics of the context in which it is delivered, so it may not be desirable to strive for the intervention to be exactly the same in all cases. A number of frameworks have been developed that focus on implementation. For example, RE-AIM is an evaluation framework that focuses on the external validity of a trial. It describes a number of features that relate to the successful integration of the intervention into real-world settings. It stands for reach, effectiveness, adoption, implementation, and maintenance. Reach refers to how many of the target population were involved in the evaluation and how representative they are of that target population. Effectiveness is about the range of effects an intervention can have. For example, even if the intervention was successful, did it, for example, have any unintended or negative consequences? Did participants find it stressful or upsetting? Adoption refers to whether the users are persuaded of the utility of the intervention, and this is critical. Interventions are much more likely to be adopted if it is easily implemented, if users and providers like it, and if it is compatible with their other goals. Implementation refers to the ease and feasibility of faithful delivery. Developers have to consider the resources in the community in which an intervention is to be offered. If the intervention is complex, expensive, or requires specialist training, then it is less likely to be sustainable in real-world settings. Finally, maintenance refers to the longer-term sustainability of the intervention in real-world settings. If an organisation or community does not have the resources to deliver the intervention, then no matter how effective it is, it will be dropped over time. So when conducting process evaluation, these factors should be kept in mind. The second element of process evaluation is measurement of the regulatory or causal mechanisms that the intervention was designed to change. These may be seen as mediators of the effectiveness of the intervention, so one would expect change in behaviour to be explained or partly explained by changes in target mechanisms. It involves extending causal assumptions from the intervention will lead to a change in the outcome to saying the intervention will lead to a change in the mediating variable, which will in turn lead to a change in the outcome. Statistical techniques such as mediation and moderation analyses can be used to examine causal processes and the influence of contextual factors. However, these can also be examined qualitatively. And finally, contextual factors are factors that are external to the intervention. Such factors can affect the delivery, implementation, and the causal mechanisms, so it's necessary to consider possible contextual factors that are likely to do so. And this can include characteristics of those delivering or receiving the intervention and the setting in which it is delivered. It is possible that an intervention will work better for a particular subgroup of participants, such as those from a more disadvantaged background, or when delivered in one context rather than another. The ASSIST trial provides a good example of the type of information that a process evaluation can provide. This programme is a school-based, peer-led intervention to reduce smoking. In that trial, nominated students were trained to be peer supporters and support other students to quit smoking. Process data were collected from teachers, peers, trainers, and other students using observations, questionnaires, and interviews. The outcome evaluation showed that the intervention led to a reduction in smoking uptake amongst occasional and experimental smokers, but had little impact on regular smokers. Process evaluation data suggested that this may be due to the fact that peer supporters concentrated their efforts on those they felt could be influenced and not those who were already addicted. So this was largely an implementation issue in that the programme did not reach the entire population. This then had implications for future replications of the programme. So process evaluation is a study of processes. It's not just a list of delivery components, although these do need to be measured. The main focus is on understanding the causal pathways by which the intervention leads to change. Process evaluation is part of a family of evaluation called theory-based evaluation. Theory-based evaluation structures the evaluation around the underpinning theory of an intervention. So the evaluation team develops a theory which explains how an intervention works, and this forms the basis for data collection and analysis. Although interventions are not always based on academic theory, all interventions are theory incarnate, in that they are based on some assumption that the intervention will lead to a desired change. The theory underpinning the intervention is evident in the intervention design because the intervention is targeting particular factors. So, for example, an information leaflet is based on the theory or assumption that lack of knowledge is a modifiable determinant of the behaviour in question. So the second part of this talk is about how process evaluation should be conducted. The first step in process evaluation is all about planning, and this is where you make all the important decisions about process evaluation. This includes things such as who will conduct the evaluation, who will be involved in decisions and what will their roles be, what will the scope of the evaluation be, and it's also important to think about things such as budgets and resources. Achieving a good quality process evaluation is almost impossible without establishing good working relationships with stakeholders involved in developing or delivering the intervention. This should include patient and public involvement. It's useful to start by developing a communication plan so that the structures are in place should certain situations occur. For example, what would happen if the process evaluation team learn that an intervention is being implemented incorrectly? Is this information fed back immediately, or should the team remain passive observers? Also consider whether the process evaluation team are part of the outcome evaluation team. Some researchers prefer to keep this separate, whereas others prefer to use a joint approach, and there are pros and cons of each. Process evaluation teams should consist of a range of individuals, including individuals with expertise in the different methods, different knowledge of the field, theory and setting in which the intervention is taking place. Including patients and participants is also highly recommended, and good communication between the team is crucial. The next step in the planning stage is to define the intervention and clarify causal assumptions. Defining the intervention is sometimes more difficult than it sounds. For some interventions, it's not instantly clear where the barriers lie, and the researchers need to work out what exactly the intervention is and what it isn't, and different stakeholders may have different opinions on this. Next, decide the core aims and the research question. What exactly is it that you want to focus on? And choose your methodology in line with these aims and the research question. And at the end, disseminate your findings. When deciding on research aims and the research question, it is important to prioritise. A process evaluation is potentially a long and complicated study, and resources will be limited, so key research questions must be prioritised. Knowledge and research in a field may be uneven, with some aspects not being well understood, while others are more so. The evaluation team might be aware of gaps in the knowledge and want to prioritise the process evaluation around these. If the intervention is novel, then the process evaluation team might want to prioritise questions about how it can be feasibly implemented. If the process evaluation is of an established intervention, there may be more interest in understanding how the intervention works for new populations or in confirming the underlying theory. One way of making programme assumptions clear is to put them in a logic model. Logic models should be based on theory, and then data collection is based on the logic model. It's useful to distinguish between theory that explains how an intervention is delivered and theory that explains how an intervention brings about behaviour change. The first might draw on, for example, organisational theory, whereas the second might use psychological theory. So the theory of change, which explains how an intervention works, should have been identified during the intervention development. If not, then the evaluation team will have to construct a theory of the intervention. Theory doesn't have to be overly complicated or abstract. Just using simple language to explain what you think your intervention is going to do and how exactly it is going to bring about change can really help develop an intervention theory. And no theory is perfect, so the evaluation team should allow for unexpected data and be prepared to refine the theory later on after data analysis is complete. Logic models are a simple graphic which represents the intervention's theory of change. They depict core components of the intervention, how they interact to produce change, and the structures that are needed to ensure implementation. They should be developed during the intervention's development stage and should be adaptive for each intervention. There are a wide range of approaches to logic modelling, although there are some common elements such as representing cause and effect and distinguishing between the intervention delivery and outcomes. Apart from these, they should be adapted for each particular intervention. So for an intervention that has specified short, medium and long-term outcomes, then these stages of outcomes should appear in the logic model, and the logic model should be used to structure the data collection and analysis, so you would collect data at each stage. Process evaluation will usually lead to some sort of revision in the logic model, either during the evaluation or at the end as new data emerges and the intervention theory is revised. Sometimes different stakeholders have different theories about how an intervention is going to work, and logic models are really useful for highlighting these different perspectives. They can also highlight possible unintended consequences. As a result of collecting data at each stage of the logic model, we can identify any weaknesses in the chain. In other words, we can see exactly when and if the intervention fails. Logic models are simple, and because of this they can be useful in representing how an intervention is theorised to work and can be relatively straightforward to use in a process evaluation. In practice, they tread a fine line between being easy to understand and reflecting the complexity of the real world. Their simplicity results in several limitations. So, for example, they only represent one theory of change, and researchers and stakeholders may have several. They have a limited number of elements. Even though they prioritise the main aspects of the intervention, they don't represent all the factors that contribute to the intervention outcomes. They don't take into account that the intervention may change over time, and practitioners often reflect and change their practice, especially if they think an intervention isn't working as well as it might be. So the final intervention may actually be subtly but fundamentally different to the earlier intervention. So a logic model may look something like this, specifying firstly the problem, the delivery, the intervention, the anticipated behaviour change, and the short, medium and long-term outcomes. So this is an example of a simple logic model. In this model, the problem is that 1 in 4 adults have high blood pressure. The programme involves 10 group physical activity sessions delivered once a week by trainers or delivery providers, and trainers also complete 2 training sessions to learn how to deliver the programme. The predicted mechanisms of impact include confidence, self-monitoring and social support. So it is thought that through targeting these mechanisms, changes will occur in levels of exercise and as a result of this, reduced blood pressure. This is just an example, and your logic model may look very different. On to methods. The choice of your method should be influenced by your research question. Process evaluations often use qualitative and quantitative methods, and mixed methods are really useful in trying to understand causal processes in complex interventions because they address different aspects and can be brought together to explain the overall intervention effect and how it works. Typical qualitative methods are interviews, focus groups and observations, and qualitative data can be used to examine, for example, the experiences of delivery staff and participants in the intervention. They provide in-depth data and are flexible to allow unanticipated themes to emerge. So we may do a qualitative study to explore the psychological changes that change over the course of an intervention. This could be done, for example, by interviewing participants before, after or during the intervention sessions. Typical quantitative methods are the collection of routine data, satisfaction or acceptability questionnaires, statistical analysis of causal mechanisms, so mediation and moderation analysis, and qualitative data can be used to examine relationships between factors such as gender or age of participants and their attention rates in an intervention. There are multiple ways to combine qualitative and quantitative methods. So, for example, methods can be used sequentially to build on each other, such as using interviews to expand and explain on the data that was collected during a quantitative survey, or they can be brought together concurrently, either to test findings against each other or in a complementary way to build a comprehensive understanding of a particular situation. There are other ways to analyse data, and it's important to use your data in a way that answers your questions and meets the needs of the situation in question. And so you've conducted your process evaluation, collected and analysed the data, and all that's left is to report and disseminate your findings. This may be in journal articles or written or verbal reports. Always make sure that you report your findings in a way that answers the questions your funders or audience want to know. Quality standards for reporting randomised controlled trials and qualitative research exist and are commonly used to report process evaluations. If the process and outcome evaluations are being run concurrently, it may be necessary to analyse data separately and to report findings together at the end of the study. This is because if the outcomes data are already known by the evaluation team, this knowledge may bias the analysis of the data towards agreement with the outcomes data or vice versa. If the process evaluation is conducted in a field that is dominated by quantitative methods, the standards of reporting the qualitative methods may receive less attention, so extra care is needed to ensure the quality of the quantitative methods because these are equally as valid and important.